Everybody, this is show 185. This is our mascot, Rocco. Hi, Rocco. Say hello to the fans, Rocco. There you go. Look at that. Unbelievable. Very good dog. This dog is unbelievable. He's terrific. Okay, moving along. You're here again. This is Gino Frantalone, my co-host. And today, from Visiting Angels of Acton. You're not related to the LA Angels, right?
No,
no.
not.
Well, good, because they're terrible. And, oh, hi, baby. And your place is in Acton, is that correct?
The office is in Acton, yes.
See that? And on 2A, folks, on Great Road. Mm-hmm. Okay, would you like to add something?
I wanted to say thank you for letting me bring this young lady here and to tell us a story. I feel in Acton, there's a nice lot of people there, and she came to Gino's show, and she made a nice presentation, and I hope that somebody from Acton understand the story. So I hope that over here in Westford, thank you for letting me come with this young lady.
Oh, anytime.
To tell her story.
Do you cover Westford?
We do. Our territory goes from Lexington to Lancaster, Tingsboro to Stowe. So Westford is within our
I think there's a song
catchment.
there.
Yeah. So I can tell you a little bit more about us.
I think you should, because we have a half hour.
Okay. So my husband and I were looking for care for my parents, and that's how we found Visiting Angels. And we were that impressed with it, and he's an accountant, I'm a nurse. We said, you know, we could do that. So 16 years ago, we opened our office, and we're still serving the community. Visiting Angels is a franchise, international now. Our office is independently owned and operated, and we have almost, I think, 30 in New England, with most of them being in Massachusetts. So there's Visiting Angels near you somewhere. We provide in-home care for adults and seniors. Everybody, as they age, they want to stay in place. They don't want to move. Then you have issues also, not just of their health, but their families have moved away. We don't have the close extended families everywhere that we used to. Or even if they're nearby, they're the sandwich generation. The kids are working and they have kids of their own. So everybody needs a little help. And our services range according to what the client needs. We do all the activities of daily living. You'll hear that term, ADLs, and that's bathing, grooming, toileting, ambulation. I'm trying to think what else.
What's ambulation? Movement? Walking,
assistance with walking, transfers, making sure that they get in and out of the shower safely, those kind of things. And also what they call the instrumental activities of daily living, or IADLs is the term. And that's the things that they also need help with. Some meal prep, their laundry, shopping errands, keeping the place clean and tidy. So we can do all of that. We do med reminders, but we are non-medical. If there is a medical need where they need a nursing function, then the visiting nurse does that. They usually will do X number of visits, Y hours, or something like that.
Is a visiting nurse associated with you or not?
No, they're independent. They're separate. They're a medical nursing organization. So let's say someone comes home from the hospital and they need to get their wounds checked or their medications monitored or something like that. The visiting nurse will come in, depending on the needs, anywhere from once a week to a couple times a week. But the rest of the things that they need help with, that's what we do. So they're complementary in that way, but they're not the same.
I know Emerson Hospital has. Don't they have visiting nurses from there?
They have their own home care agency, yes. Yeah, it's not uncommon now, but it's the same thing. Those agencies, the medical nursing agencies, are paid by Medicare. And you have to meet those ADLs that I talked about. They have to have some ADLs. But they're doing the nursing. They don't do the homemaking. They're not going to do the laundry. They're not going to give do their shopping. They're not going to make meals for them, but they'll do the other services.
Now, since you're a nurse, couldn't you technically be qualified?
that was one of the choices I made, was to go non-medical. And I'll tell you, that's mostly paperwork and insurance.
I'm sorry, Gino.
Yeah. So there's a lot of that available, that kind of support. Kind of segs into educating the consumers. People don't really understand the difference between the home health care and the home care, so that's one of our purposes. You don't always need both. And home care, unfortunately, still is not covered under Medicare.
And do you have any idea why?
It's kind of in the works, but it just isn't there yet.
There's a lot of things in the works.
There's a lot of things in the works.
Takes time.
Huh?
Yeah, you have Medicare A, which covers hospitals, B, which covers doctors, and now the C, which is contracted out to insurance agencies, and they do, you know, your meds, your vision, your dental, that kind of thing. But home care itself is still more under Medicare, and even that is limited. Medicaid is a state program, and it's income driven, and it varies according to whatever state agency. They all have their own criteria, their own budget. Sometimes you can get a decent amount of care, and it's a budget thing. It's a state budget. Other people don't get more than an hour here or there. So, you know.
What's it called in Massachusetts? Health something?
What's that?
What's it called in Massachusetts, the Medicare thing?
Medicaid?
No, what they call it, the state, their own program. You know what they call it? Is it health something?
Oh, the Aging Service Access Points. That's where you, like, in this area, it's either, I think it's Minuteman Senior Services, and they manage, they address all that. So basically it is private pay, which can be hard for people. Most of our clients have families chip in to help them with that. If they can't physically be there, then they help financially. If people have long-term care insurance, that can help. And again, it depends on you always have to check your own policy on how much it covers. And it is, there is a waiting period, but it is retroactive. And we bill the client, they pay us, and then the insurance company reimburses them. But there's not that many people that do it.
Well, 10 to 11 care. Long-term care
it is hard.
It's a lot of money.
It adds up to a lot of money.
Yeah, but it's worth it, though, I believe. If you can afford it.
Well, we think it is, obviously.
See that? And I think that you should have it.
Well, we can talk a little bit about that, too. It's private versus agency versus registry. A lot of people are hiring under the table kind of thing, private people. And then you get into, do they actually qualify to be contractors to get that 1099? Who's paying the taxes and insurance kind of thing? So that can be a risk if you don't do that. If you hire somebody privately, you are the employer. You're responsible. Did you check the references and background checks? Do you have the adequate insurance to cover it? And supervising them. What do you do if they don't show up or they don't do the job right?
It's heave-ho.
Yeah, but then what do you have for backup? You know, so
but you can't have somebody around who's incompetent.
No. But that's what the risks that you take when you hire privately. There's also registries out there which help connect you up, and they think that they're the employers, but they're not. They're just taking a fee to connect you. So again, you become the employer, and you have those same issues. With the agency, yes, you're paying, but we're also covering the taxes, the insurance, the liability, and the backup. So that's what the advantages, and that's what we pay for. And like I said, it's a work in progress. We work with people. We try to make sure that they get their minimum needs met and the most affordable options to them. And we're happy to, give them resources if it doesn't work for them.
When are you thinking of trying it?
I'm very, very lucky that I have no problem. But the question is, like you say, sometime you never know in life.
That you have a problem.
Yeah, it's true.
There's so many people that do need the help and are falling through the cracks, and it's unfortunate, but what can I tell you about that? There's a lot of people out there that could have a better quality of life with a little help. But like I said, it is nowadays everybody's having some kind of financial struggle. That's a fact of life, and you know.
But you gotta love inflation.
Not really. So, I think I mentioned earlier that we cover a wide area. So what we have is certified nursing assistants or home health aides. We have a few companion homemakers, but most people need more than that. So we tend to encourage people to have already had that training and be ready to do that. But it involves travel for them, and it's the same thing. If they have kids, their hours are limited. Travel, you know, if they live in, let's say, Fitchburg, they're not going to want to go to Lexington, you know, for short shifts.
They want to stay local. They want to stay local.
They stay local.
How about a strong northwest wind? That'll help them.
Yeah. The other part is, again, people financially, they might only take 4-hour shifts. Well, that caregiver needs more than 4 hours. So we either have to get them several clients, piggyback it. They have to be flexible in what their hours are. You know, it's a puzzle.
So some people actually needs more than 3 or 4 hours, right? Some people need 24 hours a day.
Yeah. Yeah, we do. We can do up to 24/7.
Right.
If people they stay there, or you'd have another person come in.
That's a term that people call live-in. We refer to it as extended shift because they don't actually move in. They just stay for, you know, a block of time, which can be several days at a time. And there is a limitation there. If that person doesn't sleep at night, then they really can't do it, because then that caregiver does not get any rest, and that puts them both at risk. So they aren't always eligible for that. It's a price break, but whether it's a fit, that's a different thing. So the most common 24/7 scenario we have is the 212s, but sometimes we'll do 8s or 6s, whatever it is, to get them the coverage. Our typical client is 4-hour blocks, 3 days a week.
3 days a week?
Yeah, that's the typical one, the one that doesn't need someone there all the time. And we ask for that 4-hour minimum because they're looking for cleaning, shopping, meal prep, laundry, and maybe personal care.
No, it's like more than 4 hours.
Well, that's just it. So laundry's done on one day, shopping on another. But we also can't rush them. You help them up in the morning, get them the shower. I mean, you know, I'm slowing down too. It takes me more than a few minutes. And, you know, fix a meal and then go do what they need done. And then remind them to take their meds, fix them another meal before they leave, or leave something for that night. It takes that 4 hours without rushing them and makes them comfortable. So
you got to be healthy, because if you fill in that category, it's going to be very difficult for not only for you, for
What are
me.
you talking to me for?
And then the other type, the
because
client.
you're a young guy.
The other type of client we have is the family's nearby, but they're working. So we can be there 8, 10, 12 hours a day to make sure that they're taken care of, and that person can go to work, you know, and do what they need to do. Sometimes we have just overnights, so the family can rest. That's another one. And then we already talked about the extended shift, where someone goes in and stays for blocks of, you know, several days at a time. So we usually have what we call them the team of 2 or 3 people to cover that. But that only works if that person doesn't keep them up 24/7 as well. There's that.
Come on, sleeping pill.
Yeah. So there's a lot of there. Like I said, we try to customize it to what that client needs.
It's hard. I mean, it's hard for the individual.
Can they get any help from
the state?
From the state help paying some of this?
Yes, if they have to meet the income guidelines, and they can get X amount maybe covered, but it's not going to cover the whole amount. And if the state is paying for it, they usually, the most common scenario is you have to work with their contracted agencies. Yeah. The other thing is they have the PCA program, where they can they give them the X amount to hire somebody on their own. And that's where you see a lot of the hires, but there is a state PCA program as well. So it's there, but it's limited, obviously.
Well, they got to spend money on the MTA, you know.
We got to fix the bridges and the
Never
roads.
get any. Fix the bridges? Come now, when is that done? Until it collapses, then they do it.
Well, that's what I saw in the news this morning. The Tobin and the Sagamore are going to get replaced someday.
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 Don't look at me, I'm not going.
Yeah.
Well, I mean, come on, it's ridiculous.
So most people want to stay in their own homes, obviously.
Yeah.
The family wants them to try and stay in their own homes. And we try to support them as much as we can. Occasionally we've made the recommendation that they may do better in a different setting. I had one lady that she was very alert, wanted to be very social. She was just physically a little frail. What she really needed was socialization. So we did recommend to that family that they might want to look into an assisted living, because an assisted living, which is not a good name for it, the assistance they give is the dining room meals and the activities. And that's what someone like her could benefit from.
But that is expensive too, right?
It's expensive too, but what she really needed was the activities and the socialization. She's the exception, but we do recommend it if we think, if you're going to spend this much money, pros and cons. But most people go to assisted living thinking they're going to get all that bathing, toileting, cleaning, and
they don't.
Help with the walking. And no, that's not what it was set up for, and they don't get that much.
I see.
So occasionally we'll actually be in the assisted living as a supplement that the family pays for, or even in a nursing home. Sometimes the family pays us to go in and stay with them.
Some individual don't have no more family.
That's the hard part. These are the people that fall in the cracks, and it's very sad. But we try to get them, and the town social workers, the council on aging, and so on, as resources for them.
I'm getting crowded here. He decided to lay down.
Yeah,
He's a handsome boy.
I can't get my legs unlocked. I need more room. Jeez. Come on, doggy, stop that. Oh, there it is.
Yeah.
Good doggy.
So what do you think? Are you going to be able?
I think
you'll be able to be, like you say, you're very lucky you have a wife that she's very energetic and everything. But what happens if it's something that she cannot help you with?
Mm-hmm.
They're going to send you to a assisted living. Can you afford it?
Send me?
Yeah, you never know.
Don't send me kicking.
In terms of the education of the consumer, what's important to know too is that in Massachusetts there is no licensure for home care.
No?
No, when we first opened our agency, we were overseen by the Department of Labor, who, for manpower reasons, just stopped doing that. So that's another reason you see a great proliferation, because there's no waiting for licensure from the state, and that's most of them are perfectly good and everything, but we went and made sure we got accredited, and we recommend people to look for an agency that's accredited, because that's the closest thing to a licensure. Licensure is back in the state, but the bill, how those go. They stay in the committee forever. They don't get voted on. I am proud to say that I contributed to the accreditation standards, and the Home Care Alliance does have the bill before the legislature, so we have high hopes.
That was good.
Before the legislature.
Yes, well,
it means we may act on it sometime.
Sometime.
Well,
but there's a lot of people.
They spend a lot of people working on it, changing the language and so on and so forth, but it is based on the accreditation
so that
standards.
you won't recognize it if it gets passed.
Yeah, there's that. I mean, the union's involved in that too. I mean, they have their own bill out there, and so we don't want to talk about them.
No, we don't want to do that.
You got to be healthy, live to be 100, and then pass away. You don't have to worry about go to the hospital or have anybody to take care of you. Because sometimes, some people, they are lonely only, and they have nobody.
And because they can't get out.
And they can't go anywhere. They can't do anything.
They get a dog.
I would say that most of the towns around here, we're very lucky. They have a good council on aging. They have good social work. And
that's good.
They reach out.
That's good. Thank you.
That's good to know.
Yeah.
Yeah.
We have a council here,
Yeah, you're right.
Well, is there anything else you'd like to cover? We got 8.5 minutes. Look at the dog here.
I wanted to say,
Oh, come on, baby. What do you?
I wanted to say that first of all, I appreciate that you let us come here, and second is that this young lady and the husband has the very nice company, and they're very reliable, and they're really there to help anybody that needs some help. And if they have any difficulty, they'll be able to guide them in the right direction. That is the best thing you can do for anybody.
You want to do a takeover? We'll do a takeover bid. Well, thank you for coming. We have anything else you'd like to say?
No. I think we covered all the things.
I got my foot.
Just let
The
them
dog
know.
is on.
They can call anytime to that particular number.
Yep, so Gino's telling me to let everybody know that we are at 498 Great Road in Acton. Our number is 978-263-1212. Our email is acton@visitingangels.com, and we're happy to answer any questions.
Thank you, young lady, for coming here. And I understand that people, they probably will say, that's very interesting because I didn't see that anyplace else. See, you get credit for it in Westford.
Actually,
I have a question here. You have two. Go ahead. There's two emails there, right? Oh, one's a website.
one's the website.
Okay.
And actually, I could say that. It's www.visitingangels.com/Acton for our specific website.
See, you could have said that.
And, you know, even though you don't need any assistance right now, you may know somebody who needs assistance. You may know somebody who's looking for work, by the way, because we do our own training. But it's always good to check these options out before you need them, because what we find is they go in the hospital, and then when they come home, they find that now they really need the help and they want it right now. And
Yes. That is true.
And it's the days of getting somebody there in 2 hours is pretty much past.
We can do it in 2:31.
Yes, we can.
It's a good idea to at least look into it before you need it.
Well, I'd like to say thank you so much for coming in Westford, and I hope people in Westford will be able to understand the situation, and if they can help somebody, a friend or family member, you just get in touch with this young lady here, and I'll be very happy, okay? Thank you so much for taking in Westford, and thank you to you.
I'm trying to get my foot loose.
Oh my God. Edward Cohen. I was very lucky that Edward Cohen let me be a vice.
What? We don't have a vice squad here. Thank you very much.
I'm trying to make you laugh.
Well, my foot's gonna go numb here.
Oh my God, you're right.
Maybe.
And we have a mascot.
Thank you so much.
Good puppies.
You want to move
And thank
a little
you
bit?
very much for letting me come on.
Certainly.
Happy
A
to
pleasure.
talk
My
about
pleasure. So, hey. All right, so will you get out? Stop it. Stop it.
He's asleep.
So we'll be back.
He's asleep.
We'll be back on the 28th of September with a show with the director of the Council on Aging right here in Westford.
Beautiful. We can advise them if anybody that needs some help, we can send them to Westford.
Well, for a nominal fee, we can do that. All right, thank you very much, Karen.
Thank you.
Thank you for getting on my foot. All right, bye-bye, everybody.
Bye-bye.
Ed Sullivan is dead, but Cohen isn't. And when it comes to weather, Cohen's smart. As New York as you get, his money's on the Mets, which goes to show that Ed's a Joe who always bets his heart. You'll hear a slick review or two from Nicky, and Cantor Something Berg will sing some song. There's weather news and shtick, enough to make you sick. You'll be glad you came along.